Pain. You're my last resort.
No, look at me. It is your last stop. I can't send you anywhere else after this, okay? That's swelling.
Oh. I felt like I got punched in the face. Yeah. And then it just all opened. My headache is gone though.
Oh, nice.
It's the first time in 13 years I have not felt it. You know?
Welcome to the office. Hi.
Hi.
Hi, Natalie.
Hi.
Nice to meet
Nice
you.
to meet you.
So, you're coming here from Florida.
Yes.
From Miami.
Yeah.
What brings you here from Miami? What's going on?
Pain.
What kind of pain?
I mean, it started on my right low back.
Okay.
Went into now my knee, and then my neck.
All right.
And my shoulders.
Okay. So you got some stuff.
Yeah.
Hold on. Started in your right low back. When?
I'd say 2013 after my inguinal hernia.
Inguinal hernia, right side?
On the right side.
Right
Mesh.
side.
Yeah.
You had surgery for it?
Surgery.
They put a mesh? Okay, and after that, what happened?
After that, my healing process took a long time, and I was always like having a burning sensation. I just always had a weird pain, and a sensation went to my buttocks all the way down.
Did it go past the knee?
No, right, and the knee has been the past 3 months, the inside of my knee.
Okay. Sounds good.
You're my last resort.
Oy.
Yeah, no pressure.
No pressure.
No pressure.
So, 1 is the back, 2 is the shoulders, kind of feeling it pulling towards you. You can't get that
Like
release.
I can't take a deep breath, kind of.
So you need to learn diaphragm breathing. You have a lot. You breathe like an anxious person. You have anxiety. I'm assuming.
You're like my last straw.
Okay.
So I'm a little
But
nervous.
you've been breathing like that for a while.
I think so.
Breathe, deep breath, and down. So what I want you guys to notice when she's taking a deep breath, she's a chest breather. We should be breathing a little bit more through our stomach. And I'm going to teach you that probably second, third visit, okay? Breathe again. Good. Digestion is a little bit off too. Okay, no worries. What else?
There's like a really sharp pain, again on my lower right side, going forward and definitely going backwards.
That's different from the other stuff?
Yeah.
That's a new thing?
No, it's always been there.
Okay.
It's kind of like 3 spots. It's like this part, and then my low, like if I lean back or forward, like I could feel like a.
In your tailbone or in your glute?
I don't know where it is. No, it's in my.
It's more in the center?
Yeah.
Okay. All right.
Whatever that area is.
Okay, that makes sense. How is it that you have to travel across the country to see me? I don't get it.
Because I can't get an answer from anybody. It's just been a lot of like cortisone shots for pain. A lot of it is they blame it on the fact that because of my inguinal hernia, there might have been nerve damage. And due to that, I could be...
Did they do an NCV, a nerve conduction test, to test the nerves?
No, just MRI and CT scans.
Okay. You ready for the journey?
Yeah, I'm ready.
Let's do it. She's excited.
I am.
She's like anxiously...
I'm like, I can't wait.
Can I explain one thing about this anxiety and excitement? There is one physiological difference between anxiety and excitement. And the way you're going to start to shift this anxiety to excitement is through your breath.
Okay.
This is your last soap. Look at me. It is your last stop. No, look at me. It is your last stop. I can't send you anywhere else after this, okay? You're going to ruin my equipment. I'm joking. I'm joking.
I appreciate it, I do.
Okay, so this is your last stop. And I'm usually the last stop for a lot of people. I'm never the first person people come to see.
Yeah.
And that's okay. That's just the nature of what I do. And I have to actually accept that as well. So let's get started. Come over here.
Okay.
On this x-ray, we're looking at your curvature. We're looking at your posture. And the first thing, your answer to your shoulders is very simple. It's very clear and it's very simple. Your whole upper body sits behind your foundation. Your muscles are working overtime just to hold you in place. So we need to get this, okay? Mm-hmm. That's what needs to happen. and it needs to, I'm hoping before you leave, it's going to be uncomfortable to sit like this and stand like this.
Okay.
I need to shift it with you.
Okay.
Okay?
All right.
So that's your upper shoulder stuff. Let's go over here. Let's talk about your foundation. It looks a little bit off. Here's what's interesting. You kind of veer to the right. So we look at the tailbone here. You see these nubs, right? But this one right here is kind of significant to me. And why is that significant? When we go back here, you can see that the tailbone is tilting from this, it's tilting on an angle. Yes?
Where's the tailbone right there?
This is the sacrum. This whole thing is the tailbone, the
Okay,
sacrum.
got it,
Sorry.
got it.
The right side is down. Now, if we look at the numbers, the measurement actually shows it's 3 millimeters down on the right side.
Right.
And it's 7 millimeters rotated on the right side. So it's going down and back. Okay? Follow my process.
Right.
Your left pelvis goes down and out. So the overall effect is you're going like, you're nose diving to the right. This is the way your body wants to go. And then you're probably fighting it to pull it the other way. So this is your imbalance. And this is all starting in your
Tailbone.
sacrum.
Oh, my sacrum, yeah.
Okay, now follow my process. Let's get to these numbers. If we look at the numbers, it says this. We have a measured difference. So there's only a 1 millimeter leg length discrepancy, okay? Which means 1 millimeter is nothing. Anything under 7 millimeters, adjustments will hold. Here's what's interesting. The actual difference is 5. And the AD, which is the actual difference, means this. If we correct the pelvis, right, it's going to change the femur head. If I correct your left pelvis, it's going to make your hips worse.
Okay.
So the answer is not your pelvis.
Seriously. Wow.
The pelvis came later.
Wow.
The tailbone was first. That's the key. Okay? Does that make sense?
Yes.
So whatever tailbone injury you had started the imbalance. Did you have a pelvic issue as well? Yes. And that was why you got your inguinal.
The inguinal hernia?
Now, the inguinal hernia that we've seen in the work is usually from a ASIN, a internally rotated pelvis. Now, when I reference this, this is based on the listing system. If this is PIEX, that means the right is ASIN, which predisposed your, with a rotated sacrum on the same side, predisposed your hernia.
Wow. Wow.
Okay?
Yes, I understand
That's
what you're
it.
saying.
Simple.
Wild.
So, it's this. We said this is going, but let's now do the right side.
Mm-hmm.
The right goes up and it turns in. The sacrum turns with it and it goes down.
Mm-hmm.
And that's what pulled in the front. This whole spine is compensating for a tailbone. Did you ask if you had a cervical rib? I don't really see a cervical rib. I do see, however, a little bit of your C7 extension on your left side. This is interesting. Let's zoom in. So this is your T1 here. Look. This is your T1. That's your T1 rib.
Right.
I think you're talking about that. That's we can say that's a pseudo extension. Yes,
So
I will agree. But that's not causing your pain.
Oh, it's not. Okay.
But it is an overgrowth of the C7 vertebrae.
Born that way?
Yeah, you were born that way.
Okay.
So these are the vertebrae. We have 7 bones in the cervical spine. 2, 3, 4, 5, 6. This is C7 here, okay? This is your C7. The transverse process of C7 isn't very big.
Mm-hmm.
Your left is an extension of that transverse. A pseudo rib, not really a true cervical rib, but that's not causing you pain. This is your neutral cervical x-ray. This is extension. They all move back fine. Let's look at flexion and see. Is there anything not moving? 2 move, 3 move, 4 move, 5 move, 6 move, 7 possibly. It's a little shady there. But the issue is not in your neck. Maybe 7, maybe. And I think it's maybe a little bit here from this side. Maybe. As you're walking, anything hurting?
Yes.
What's hurting? Right side?
Yeah, like all in here.
On the inside,
Yeah.
okay. Keep going. Keep
And a
going.
little bit of my ankle.
So she got a lot of puffiness in her sacrum. That's obvious. Come over here, turn around. So here's what's happening. This here, this is swelling.
Yeah.
This is inflammation. And what I'm watching is it's actually tilting like this. So all this swelling, when she's walking, This side is stuck, so she's moving, but she's also side hustling or side wiggling. Go ahead and walk for us. So yeah, it kind of nosedives to the right side when you walk. It does. Keep marching. My hand is here. Close your eyes. And she's off.
Am I?
Open your eyes. I'm back.
I can't believe it.
Come back over here. So foundation is off, upper cervical is off. March in place. Close your eyes. And
I'm even trying. I
I
can't
know.
believe it. I can't believe it.
have a seat over here. Let's get started. Now,
And this.
look. So when we're looking here, this is the EX, this is the IN. You know where that's coming from? You're going to trip.
No idea.
It's from the rotation of your pelvis.
Is it?
Now watch. Come here.
They told me my leg.
This is the pelvis. Right side, left side. The right side goes out, the left side goes in. It causes a flattening
Yes.
of the right glute and a opening of the left. And let's look from top. This one comes out more than this side. That's your pelvis,
And
man.
look this.
What about it? What? What are we talking about? That's your pelvis. That's the dropped leg. That's what
Is
I'm
it?
talking about.
It's-
So this is all the mechanics of your foundation. You understand?
Yes.
That's your pelvis.
No, I didn't
So
know
your
that.
pelvis is doing this and then it's dropped. So this crease is higher, this crease is lower. That's it. Keep it simple. Now watch her, the way she sits even. She tilts to the right side. That's what we need to change. And check this out. Look at my fingers. I'm not making fun.
No,
It's
I
swelling.
know.
It's inflammation. Starting at the base of the neck. Oh, madam, 20 points on the right. And we have a right jaw, 20 points. T9, 10. Left side, 10 points. Left side, S3. Ooh! Check this out. This is really interesting. Looks like it's going to go left around S2, S3. Nope, it's down in the low. S4, S5.
Right?
S4, S5 down in the low. T9, C1 on the right. Let's check the movement of your pelvis. Open and close the knees, please. Open and close. When she does the left, the whole right moves with it. Left side only. When she does the left, there's a little movement of the right. This is that left. Pelvis EX. Scoot back. Static pelviation. Running my fingers down the spine. It starts right there. That's 10. That's 9. That's 8, not 8. 9. Listen, you could even hear it. Look, this is the lung field. Hollow. Hollow. And then tuck. That's swelling.
Is it?
That's a little bit of the art. You can hear the subluxation. Okay, come back slowly towards me. Numero 5, number 5. You're making me tilt to the right, yo.
I don't even
It's
know.
okay. 5. 1, 2, 3.
No, all I feel is like, it's like
All you're feeling
high.
is that, right?
And up here, like on the side and up there.
Okay. You got something hiding up top here, man.
Yeah.
Turn to the left, turn to the right. Head down, turn left, turn right. Tender there, tender. Ooh. Your atlas isn't sitting right. C2 on the left, atlas on the right. She don't follow the normal patterns.
That's why I came to you.
This is interesting because she has a tailbone thing, but you have no pain with it. That's the interesting part. But the other interesting part is, I have a feeling something up here is going to release that. Let's see. Problem is you've been getting twisted so many years. So I'm gonna do your C2 here, but your C1's gonna need to be there. And then we're gonna do the tailbone there. Then you're gonna walk. Then we're gonna recheck everything. And let's go ahead and set C2. C2, setting it as a PL. Right on there. Nice and easy there. Good. Let me have it. Oh wow. Gotta sit it up. Wow. It's a baby. Let's go on the other table. Right there. Oh, wow. Head down. Nothing. Denied. Head down. Relax the hands, Dave. Palms up or seated. You okay? Good? Easy. Home run. Beautiful. Hi.
Hi.
Felt that one?
Nope,
What?
I didn't.
5, 6. Wow. Oh, no. Got your 9 in sacrum. Check this out. You didn't feel the sacrum, really?
At all.
Walk for me, please.
I definitely feel something different.
Yeah. Keep walking. Come over here. Stand and march in place here. Close your eyes. Open your eyes. Let's march. Let's walk back and forth. And then let's have a seat. It's a very different case. Neck is clear. 1 point. Da-na-na-na. T9 is clear. Sacrum is clear. Let's check the pelvis now. Scoot forward, please. Feet together. Actually, before we do that, come back slowly towards me. Let's check the hips now. That's actually moving better. Let's check the SI joints, and now let's see. Feet together. Now, if you can handle it, I'm going to do the pelvis today too, okay? Feet together, open and close the knees. Left side only. Right side. So here's what's interesting. Your right is moving better. I'm going to do your left pelvis.
Okay.
It's not your right pelvis. I'm not chasing it. You know what I mean by that?
Yes. You're not gonna
The left stuff. I'm on the left glute. We're setting the EX in. I'm going to be here contacting the left side. I'm right there. Holding the right, pushing the left. This way. Okay? You okay?
Yes, sir.
And that's the home run.
I felt that one.
Damn. Walk it out. Keep walking. That's where we're going to start, okay? March in place. Close your eyes. Open your eyes. Step back. Little different. Little different. Sit back for me, please. And let's test this again. Back towards me.
It's definitely different.
It's less.
Yes.
You're moving better.
For sure different.
You made me work today.
I'm sorry.
On your back. Raise the right leg. Sit up and turn. Let me do the work. There you go. Ears. Hi.
Hi.
Tell me if
So
anything is
different.
different.
I feel so different.
Seriously.
I seriously feel so different.
I didn't feel nothing.
Wow. I did it.
I didn't feel anything. I didn't feel anything.
Wow.
A little different, yeah?
Yeah.
Stand over here, let's shake the hands. Squeeze. Elbow. Posterior ulna. Posterior radius. Posterior lunate. Posterior lateral scaphoid. Seat the joint. Squeeze.
Wow.
Squeeze. Still a little bit in the elbow.
Oh.
Hi.
Hi.
How you doing?
Good.
Squeeze. Stand on one leg. It's your homework.
It's hard.
2 minutes, eyes open. That's your homework. Practice. Other side, 2 minutes. Questions for today.
No.
Left EX pelvis, S4 set. It actually moved. When you say it didn't fail, that's what threw me off, because it actually moved. But it's okay. It's all right. S4, right S4, left EX, T9. C1, C2, I got a little bit of movement, but it wasn't this big, huge audible. Everything is clear. Your homework is walking, water, ice. One day at a time.
Yeah, no, you tell me.
Welcome to the office.
Thank you so much.
Any change today?
There's a change.
A little bit of a change.
Yes.
So I want to recap what I found and what the most important thing for me for you is, okay?
Okay.
I know you got a pain in your butt in your right side. I know that. You have that rotated sacrum. The sacrum is doing better. It's between, that 5 is the special listing. So it's the sacrum rotated and down. We got a piece of it. But that 5 is going to give you, it's between that 5 and sacrum. And it's figuring out that combo for you.
Okay.
Okay?
Okay.
That's really it. Everything else is bonus.
Okay.
Okay?
Got it.
And you know what you need to work on.
Yes.
Yes?
Yes.
Let's do this.
You're great.
Shasha, you want to tell her? It's a 5-pointer. That's the one. Talk to me. Feedback.
That hurts.
Same as earlier, more or less?
Same. More. Nothing.
5. That's what I'm showing you. Now, here's what I need from you. One simple thing. You're going to go on the knee chest table. You're going to do some cat camel stretches. You're going to receive.
Okay.
That's it.
Okay.
All right? Let's
Yeah.
do it. Tummy up, tummy down. Do that several times. So guys, I'm going to review really quickly what a special listing is. A special listing, she has an L5 PLS-M. And what that is this. So she has a posterior left superior L5, but it's in a concavity. So we have to be on the opposite AP or pillar, and we have to push it this way and torque like that. This way, this way, this way. And the only challenge with her with that is that rotated sacrum. More tender there. Yes, that's the one. So I'm on the AP, I'm on the opposite side, and I'm torquing it into me this way. Let that tummy go down, please. Good. Gotcha. That's it. Come up slowly, please. That wasn't so bad.
No.
Come on. Walk it in.
It like knocks the wind out of you for a second. Yeah. I feel like I'm walking straighter.
You see, it's not a crack though, it's a set.
Yeah. Wow.
And I don't know how to describe that to
Neither do
people.
I. I can't describe it. The swelling,
It's getting worse.
Yeah.
So tomorrow we got a big day, okay?
Okay.
Tomorrow's a big day. And tomorrow is Thursday. Tomorrow is your movement. Tomorrow is your letting go of that stuff.
Got it.
Starting the process. Figuring out your happy medium. ¿Entiendes?
Sí, señor.
See. And you'll see the vid that I'm doing here, dude. This shit is clear. Tell me what's going on here.
I'm like, I can go all the way back if you'd like.
Limbo. Come on.
Yeah, this is fine. It's a little sore.
Tailbone.
Fine. fine. It's when you put your, fine. Fine?
Tight,
Yeah,
not sharp.
yeah,
I'm going harder right now.
okay.
Stand up.
Is it feeling?
You tell me.
Yeah, a little. That's
Little
wild.
bit.
Wow. I can't believe that.
What are you talking about?
Wow.
Well, what?
I can't believe that.
What?
I'm filling out.
You feeling out?
I'm filling my.
I'm like Botox, you know? Squeeze. Squeeze. Dr. Rahim's like Botox. I'll share one funny, not funny story, but a pretty cool story. I was visiting New York. This was years ago. This was before I even opened a clinic up. Visiting some family out there. And a guy who knew me when I was a kid came to say hi. Right? We still live out in New York. So I just became a chiropractor. Squeeze. So anyway, he had this thing he mentioned. It's a really cool story, and I didn't realize the power of chiropractic. I mean, I did, but this was another cool one.
Mm-hmm.
So he's like, Rahim, I fell off a curb, slipped off the curb, hit my back, went unconscious for like 2-3 minutes. And somebody helped me off the street, took me to the hospital, blah, blah, blah. 2-3 days later, he goes, all of a sudden, muscle started to disappear on his quad.
Mm-hmm.
Quad is 4 muscles, right?
Mm-hmm.
It was the middle one. Whoever knows that one, you can write a comment. So this was basically, so you see the muscle, and then it's skin on bone.
Wow.
And I'm like, I don't know. But I just adjusted what I found, which was L4.
And it filled it back up?
He didn't tell me this till the next year I went.
Wild.
I adjusted him 3 times. And he goes, I don't know what the heck. He didn't call me, he didn't tell me. But the whole muscle came back.
Did it?
No shit.
As soon as my whole one comes back.
You
I'll
let me
let
know.
you know.
You let us
I'll
know,
let you know,
Squeeze.
yes.
But I'm just sharing that story because there is the nerve component that controls that muscle. Squeeze. Ready for a nose job?
Yeah.
On your back.
I'm not nervous.
Look down. It's there. Breathe in and out. It's already going.
Yeah, I felt that.
Breathe in. Breathe in. Chin down.
Oh my god, I feel immediate change.
Come on up.
What a difference. Wow.
Jokes aside.
Wow. My pressure is going away. That's so weird. That's so weird. Feels amazing.
You tripping.
I'm telling you, I'm
Why are you
freaking out.
tripping?
I'm shocked. Because I came in for like other things and then other things are happening. It's awesome. Cut.
What?
Cut.
Cut. Squeeze. Squeeze. Stand up. Walk it out and breathe. Make sure you're good. You're at a hotel or Airbnb?
Hotel.
Okay. So do they have a steam room where you're at, or is it a
No steam room.
No problem. You want to do some steam.
Okay.
All right.
Turn the
So
water on.
whatever you need to do to get some steam, but definitely when you get back, lots
For
and
in
lots.
here?
Yes. And typically the way I recommend
Wow.
steam after a deviated nasal septum adjustment that I perform is boil a pot of water, cover yourself with a towel sheet, topless, and just sweat it all out. And
Okay.
do that like every day for a good 2 weeks.
What's coming out? Mucus?
All this stuff.
Oh yeah? Okay.
So whatever stuff needs to come out, let it out, okay?
Okay.
Tell them. What happened?
I just said I can breathe. I don't
Come
think
here.
any stuff is coming out. I feel like
Come
I can suck it all back in.
Look.
It's wild.
That actually snaps nice.
I felt like I got
That's
punched in the
nice.
face.
Yeah.
And then it just all opened.
And then,
My headache is gone though. Do you think it was like pressure? I don't know.
We'll find out by
That was
tomorrow.
fantastic.
Take care.
Thank you.
How are you?
Hi.
Manishma. How are you?
I'm doing okay today.
Okay, so we had a few days so far, right?
Yes.
And I know you were a little nervous in the beginning. And I'm sure you're still nervous, and that's okay. But you understand what I'm doing?
Yes, I do
Yeah.
understand.
Okay. And we had a little change this morning, hopefully.
We did.
Okay. So the combo that we found is actually different from the x-ray. So here's a great example of we have to go with the patient, not the x-ray. And the combo we found for her was not the EX as it shows on the x-ray. The combo was the IN ilium with the L5. That was your combo.
It was great.
So you walked today?
I walked all day.
A little bit better today?
Yes. A
Okay.
lot better.
All right, you ready to go?
Yes.
Let's take a look. I just want to show this part because this is important. So what we ended up doing here, I want to make sure you can see it good. It shows that there's an EX here. Shows that there's a rotated sacrum on the right. Now the x-ray is based on a listing system, but in actuality, we have to go with what the patient presented, which was a right IN ilium. It goes against a couple of things. It goes against the fact that it's listed on the left. It goes against when you have a rotated sacrum on the side of an IN ilium or an ASIN or an AS ilium, you go with the rotated sacrum. Page 43 of the chapters, guys. So this is, again, another perfect example. We have to go with the patient. It's not about the film.
But the patient has to be patient.
The patient
Which I
has to be
wasn't
patient,
so
and she was
patient.
getting a little bit, you know, you get jonesing a little
I was a
bit,
little,
right?
yes.
And it's most patients.
Yeah.
You're coming from far. I get it, okay? But you gotta trust the process.
Agreed.
Even if you don't trust me, trust yourself.
Right.
You ready?
I'm ready.
Showtime. Very nice. We're gonna go with your L5. L5, 5 points. Here's the interesting part there. Let's see. What?
I'm telling you.
What?
It's wild.
Okay, guys, I'm
It's
touching your
wild.
glute, you know
Yeah,
that.
yeah, yeah.
But you know why I'm touching your
Yes.
glute? Why am I touching your glute?
Because of the indent that I came in here with.
What's going on with that
It's
indent?
filling for some magical reason.
It's filling out.
And I didn't work out in 2 days.
Back slowly. You are walking though, right?
Yes, a lot.
Good. We're gonna continue on, okay?
Mhm.
We're gonna do the IN ilium and we're gonna do the L5. Oh, yeah. All right, left ear down. Nice and buttery. Nice and buttery. Now we got the IN ilium. Now you're funny get the cobra.
Oh, yeah?
You gotta funny get the cobra. Left side down.
I've been waiting.
Yeah, they're funny get the cobra. All right, peeps. IN ilium. So the moral of the story here is go with the patient, right?
Right.
IN ilium. Easy peasy. Easy. Stealing my thunder.
Okay, take
You
that.
got the bite of the cobra already. Oh, nice. Very nice. Come on. She's smiling at least. Walk it out. And then the cobra gotta get her nose today too.
No, I can't.
Oh no.
I can't do
Oh
it
no
anymore.
Why?
It's way too sore. I can't even blow my nose.
PLS-M. So we got a torque to close the PLS. That's it. That's it. That's it. That's it. What?
I just feel like I can breathe differently.
What?
It feels good.
Tell me how the glutes are feeling here. Do the hips.
I have to lay down to do
Do
it.
what you gotta do.
It's like, I don't even want to do it because I don't feel anything, so I don't want to move anything
No, I
around.
want you to. I'm here.
No, it feels good. It really feels good.
You're scared.
I'm scared to change it. Feels
Go back.
great.
Go back.
Oh,
Don't be scared.
it's the first time in 13 years I have not felt it, you know? So I don't want to like, it's fine. It's really fine. I
To
can't
the other
believe it.
side.
It's fine.
You're hesitating.
No, I'm not.
You sure?
I'm telling you I'm not.
You trying to crack your back?
Oh, I did it by accident. Did you hear it?
You're
Oh my God.
fine.
No, it's not there, and that makes me so happy.
13 years?
13.
Neck is clear. Heat. No break. Feet together. Open and close the knees. Open and close. Feet are touching.
Yeah, no, matter.
Left side only. Right side only. Diferente.
Yes. When adjustments don't hold, is the reason because we're not fit or like doing something to
Good
strengthen our.
Well, if adjustments don't hold, what are we supposed to be doing? Because the idea is this, let's keep it simple first. Depending on the severity of the misalignment and how long you've had it, right?
Mm-hmm.
Let's take this as an example. This is optimal relationship, parallel disc, bone, disc, bone. Now, when it misaligns, let's say, it's out of alignment. I'm exaggerating the misalignment. The ligaments have shortened scar tissue, muscles, all that stuff. We make the adjustment forward, it wants to creep back. We make the adjustment forward, wants to creep back. But each time, it's a little bit less. Like today, there wasn't a lot.
Okay.
You felt it?
Yes, yes.
It moved, but it wasn't a lot.
Right.
Okay, cool. Now, the idea now is what? The movement, the posture. It's like the alignment of the car. You're driving to work, you're hitting those potholes, you get your car aligned. Don't hit the same potholes.
Right.
So in your case, it means what? You're doing your walks, you're minding your posture, you're standing all day, I know that. You gotta make sure you're moving around, you're not just standing.
No, yeah, I'm never just.
Okay, so you're moving around, you're icing, you're doing those things. This is not about going to the gym and working out right now. Elliptical with a handle. Number one rehabilitative exercise for the spine is cross-country skiing.
But the knees hurt when you do that.
Do it backwards then.
Okay.
They hurt less.
Okay.
Number one is that. Number two is going to be swimming.
Okay.
Number three is going to be walking. Number four is going to be, number three is going to be bicycle. Number four is going to be walking. Number four is going to be running. And number five is going to be walking.
Okay.
So those are your top five.
And why not heat? You said no heat.
Heat, if there's inflammation in the joint, we're adding heat to an inflamed joint.
Oh.
Doesn't make sense.
I sleep
Ice.
in bed.
Where? On your back? You can heat your butt, but ice your back.
Okay.
You can heat the glute all day long,
All right.
but you ice the back. Otherwise, the inflammation doesn't come down.
Got it.
Make sense?
Yes, perfect. Thank you.
Welcome back.
Thank you.
We're on visit number
4.
4.
Yes.
How did you do with our last visit?
It was the biggest change we had. I think we had a little free great moment
Okay, on that right hip.
on the right hip.
And I want to share because this is a really interesting case. Okay, and what do I mean by interesting? It goes against the textbook, it goes against the x-ray, it goes against everything we've been taught in Gonstead Chiropractic. And what does that mean? So she was complaining of this right hip with some other stuff, right?
Correct.
And they can go back to the other videos and see what it is. But the x-ray shows she has a left EX pelvis. Let me just pull it up. So we have a PR sacrum, P7R down on the right. We have a PI EX major on the left. And everything she's complaining about is that right glute. And what I ended up adjusting was, now this is an x-ray. If this is PIEX, this is ASIN. IN major. IN major, internally rotated major on the side of a rotated sacrum. Page 43 of the chapters, the book tells us, do the sacrum. The x-ray says if it's this side, do the pelvis. And what we found on her was a right IN ilium. And as much as even I was trying to fight it, I had to listen to the patient. And this is the big lesson. This is the big thing about your case, not about anything else. Is you gotta listen to the patient as much as you really don't want to sometimes.
Or the patient has to be persistent in saying it too.
Well, there's the
So
other
we don't
part.
know what's good for us sometimes too, hence we trust you,
Yes.
you know? So
Yes.
it's hard for me to like wanna just repeatedly say the same thing.
Correct.
Yeah.
But where we started was the start.
Right,
Now where we're at is that right hip.
yes.
And the sacrum and all that, that's clear. Well, at least it was last visit. How's the nose? How's the breathing?
Fantastic,
Okay.
fantastic.
Can you get a closer? We have something to compare it to. I'm not cracking
No, it's a,
your nose.
no, it's a little sore.
I know. Just look straight on. Okay, and we have something to compare it to. Cool. Anything you want to share?
Just my inner right knee.
Show me where.
It still hurts.
Show me where exactly. Look, this is the knee joint here. Is it here? Yes?
Yes.
Okay, all right. What she's complaining about is the medial side of the joint right here. And what that is predisposed from the hip. Because we're also taught when you have a rotated sacrum and an ASIN ilium on the same side, it predisposes medial knee pain. Now, let's take this model. Okay, and she's complaining here. What she has here is a slightly anterior on the AIN femur. It means anterior on the internal side. The internal side of the femur has gone anterior, and that produces that medial knee pain, which is predisposed from the hip and pelvis. We may set it today.
Okay.
All right?
Okay.
It's gonna hurt like hell.
Okay.
I'm joking.
Just, you know.
You know.
Just focus on the nose, not the eyes.
Awesome. You ready to get started?
Yes, I am.
All right, let's do it. Neck is clear. And you said something about this breathing issue you had.
Yeah.
And
It's my left, in my shoulder blade, or when I take a deep breath. I
show me where exactly. So she's pointing here, right there?
Yeah, it goes into my armpit a little.
Okay, so before I continue, breathe. Out. Sharper there. Or
That one.
Okay, now if I hold on the left side, breathe in. A little different.
Mm-hmm.
Head down.
Are you still holding it?
It's T5. Okay, this is T4. This is T5. This is T6. Round your back, round. Sharper there or there.
There.
Okay, I'm gonna hold it, sit up straight, take a deep breath in and out.
Yes.
T5. Let's go and back to the x-ray and let's look at your T5 rib. And that is the part that has the kink.
Is it?
T1, 2, 3, 4, 5. So it's in the apex of the concavity, the curve. And it's doing this, so it's,
It's almost like my collarbone, maybe.
it's not your collarbone.
Okay.
Look here, come here, I'll show you. You see this kink right here?
Yes.
It's right there, you're feeling it. So your
Oh,
T4,
that one.
your T4 is the side slip.
Okay.
Your T5 is where you're feeling it between your T5 rib and your T4. That's the challenge,
Why?
to fix it. Because the fix is, this thing has to get fixed.
Okay.
And the fix is fixing still
The bottom.
foundation.
I got you.
And you don't need to be doing no weights. You need to be doing elongation, stretching, swimming. You can do yoga, things like that, okay?
Okay.
And not the crazy yoga stuff, just basic stuff for right now for the next few months until I see you next, okay?
Got it.
Have a seat. Let's go back and scope.
All right.
So we need to fix the rotation of that T5 to get the fix on it. L5 sacrum there's maybe a point. No. Right pelvis. Right pelvis, T5. Heat but no break up there. Let's check the hip and see how it's doing. Feet together, open and close the knees. Open and close. Left side only, right side only. It is better, dude. Wow. Scoot back for me, please. Numero 5, right pelvis. You ready?
I'm ready.
Let's do this. Hold your wrist. Don't let go. You got it? Natalia, I'm gonna phone and get the cobra. Pop! There's a baby cobra. Come. Let's go face down. We're gonna do the eye and ilium here. Eye and ilium, high low. Look, I'm holding the left there, okay? Pushing that out that way. Got it? Good. That's it. A little more. Gotcha. Bus. Now, the challenge of your T5 is this. You don't want to be adjusting into a concavity, so we're adjusting on the opposite side to get the rotation out of the vertebrae, okay? Natalia?
Yes, sir.
See? Ah, spicy. Deep breath in. Poquito más. Drop it down. There's the rest. Let's walk it out. As you're walking, tell me.
It feels.
Just keep walking. Breathe too, please.
Still poppy a little in there.
Okay.
Okay.
How's the butt?
It's okay.
How's the rib?
The rib?
Yeah. Come back over here and see. Have a seat.
I don't know how I feel about it.
Okay. You think about it.
Yeah.
Lots of ice, okay?
Yes, sir.
Don't throw it out back out. I just put it back
Oh,
in.
okay, sorry.
The heat is gone in the neck. Relax the shoulders. Good. 5 is clear. Right side is clear. Little heat on that left side, but feet together. Open and close the knees. Open and close. Left side only. Right side. Good.
Yeah. It's like when I orged, there's like something that's in there.
This part here.
Yeah.
That's the
Like
muscle.
from the outside in.
This
Yeah,
way.
That
Yeah.
way, yeah.
That will work out with the machine.
Yeah,
Go
okay.
on your back, please. Let's do it. Yeah, absolutely. We're gonna do
Oof, I feel better, I feel better. I feel better here. Oh, yeah. It's not the nose job. I can't tell if it's the nose, what I'm feeling.
Let's set the knee. AI and female. You got work, girl. We gotta get this work
This
done.
is great, this is great.
And if it's not, it's not. It's okay. There you go. Sit up and turn. Now you guys are buffing the Polish. The buffing the Polish now, okay?
Every other doctor said my knee hurt because I gained weight. I just want you to know.
Now it's breaking up scar tissue. Round your back slowly. Bring your knee to your chest. Straighten it out. Bring it to your chest. Straighten it out.
hit anything? Is that normal for me? It's not normal.
You have to practice now. How do
And
you
how
practice?
rounded?
Yeah, you have to practice because you do that curve. And how you're going to part of that is the EX pelvis. But how do you practice it? Flat, bend your knees,
And my knee.
bend both knees, and flatten your back the best you can. Bring your belly button in and up. Practice staying in this. Does that hurt your chest when you do that? A little bit easier?
Yes.
Okay. So the idea now is bring both knees to your chest, flatten your back, hold your knees, hold. Okay? Hold them together, please, like that. Now, straighten. You can lift your head up for a second. Okay?
And so, and when I sleep little by little, it'll adjust?
Little by little, we have to remold the ligaments.
Wow.
Okay?
Oh, okay.
A little bit at a
I
time.
understand.
Let's raise this up.
I understand.
You should be feeling what? You want to feel that you're pulling that sacrum down.
Gotcha.
Okay?
Yes,
And
I do feel that.
bring your feet down, keep your knees bent. Push your tummy down. Push the small of your back. I can't work this because of the work you had done.
You can.
Okay.
I'll just cry a little bit. Ooh.
Push down. Push here. Push into my back fingers. There you go.
Oh, I've never done this before.
Push. You got to activate these muscles.
Got it.
Activate these muscles, kind of like you're bearing down. Push down here. There you go.
Okay.
Yoga
I'm
ball.
storing this, okay? Because I've never done this. This is weird for me.
Yes. Now watch.
Wow.
Now it's
Wow.
touching.
Wow.
Now it's touching.
Cool. Very
You
cool.
just have to engage these muscles, okay?
Wow.
Like you're bearing down, like you're pushing a baby out, kind of. Okay?
Wow, this is
Practice.
very different.
You can do in about.
I can't believe that. Wow.
Okay, it's practice though.
Yes.
You have to practice it. It's
Wow.
not like I give you a magical adjustment and everything straightens out. All these tissues and muscles have to be remodeled now.
Okay.
So first is going to be light yoga. Then you find yourself a good Pilates person out there, and the Pilates will work all that core for you.
Wild. Cool.
Cool.
Awesome. Thank you.
You're welcome. Walk it off one last time. Make sure the knee is a little different. What?
Wow.
What?
I don't have to lose weight.
She's a tough customer, yo.
Woo.
There you go.
You want to do my jaw today?
Absolutely.
You do?
Yeah, sit down. Up close first. Slowly open. Right pops out. We gotta do the right jaw. So the way we're gonna do this, open all the way. Open, 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 open. Hold on. Let's put the condyle lock. So we don't mess up that neck. Open all the way. Open, open. Open. Slowly close.
Wow.
4, 3. Open slow. Hi. How you doing? How you doing? Open. Voila! As my 3-year-old Kuwaiti baby said, thank you very much. Thank you very much.
Fantastic.
Squeeze.
Thank you, thank you, thank you.
Squeeze.
Oh.
I see you Monday.
See you Monday.
Take care.
Thank you.
Guys, this is a very special case. I learned a lot in this case, okay? I actually learned a lot in this case, and let's see what happens on Monday. All right, we're winding up this visit.
Yes.
Came out from Miami.
Correct.
Came out with some stuff.
Yeah. Came out with some stuff.
What kind of stuff?
A lot of pain.
Okay.
Achiness.
What kind of achiness?
Just
Just to recap.
my bottom right buttocks that would kind of penetrate all the way down to the front of my knee.
Okay.
My neck was always stiff. When I took a deep breath, there was always like a little bit of a pain. And our last steps are probably my arm.
All right, and we've had about four or five visits.
4 or 5 visits.
And tell me what's happened. Like, everything's been doing well?
Yes,
You see the difference of what's
I
happening?
definitely do.
And it's a process?
Yes.
It's a little bit of a
Yes.
process?
Yes.
Okay. And we have to go against certain principles and things in the book.
Right.
I had to go against certain things in order to really get the result for you.
Right.
And that was probably the loudest nose adjustment I've done in my career.
Yes.
And it is a tiny bit swollen, but it looks a hell of a lot better. You
I
just need to
agree.
ice there. And how's the breathing?
Unbelievable.
Okay.
I don't think I knew I had a problem breathing until you did this adjustment.
Okay.
Yeah.
Now talk to me about this hip, because that was the real issue.
Yes.
Indentation, all that stuff. Does it feel any different?
It feels very different.
Okay.
So prior, when I would extend back,
Okay.
I would be in sharp pain. So even just driving, if I try to have a better posture, I would feel something pinching in my bottom right.
Okay.
And after our adjustments, I would also try to click out my hip.
Is it clicking?
It's not clicking.
Okay, good.
But what I realized as we've done adjustments, when I bring my leg inward,
Yes.
opposed to before where it was outward,
Okay.
or if I go forward in any way, I can feel it.
Okay. So we need
So
to.
out, I'm fine. Now in, it like radiates, and now it's like to the back.
So
of
hold
my
on.
knee.
So you're saying if you bring it out, you're fine.
Out, I'm fine, and if I push down, I'm fine.
Okay. And
So if I'm
that's
forward and I push down, I don't feel it.
okay. Whereas before.
It didn't matter, right, up, down, left.
Okay. So it's
So
just.
now it's just in, or if I'm regular and I'm forward, I feel it.
We want to be mindful of the forward just temporarily. We want to do lots of icing.
Okay.
Remember, we worked on pelvis, we worked on sacrum as well. And if we're rounding our back, just for right now, those tissues need to heal.
Okay.
Okay? So we took a big pressure off the back. It's like taking the 40-pound rock off your foot.
Right.
It just needs a little healing time. And I would say probably in a couple months you're coming back.
Yes.
And try to spend about 3-4 days, 5 days if you can.
Absolutely.
Okay? And it's not so much adjusting. Maybe it's every day, maybe it's not. I don't know. Okay? But what I do know is things are healing now.
Oh, I feel different for sure.
And now the major issue is what? Your arm? But
That's
you didn't come
high.
in for that.
That's how high. No, I didn't. Well, I pick and choose.
Okay.
Now that I'm feeling better, I'm getting it
She
all.
thinks it's a smorgasbord over here, guys. No, she's been a good patient. She's been very responsive, and she's been given some really good feedback in terms of what she's feeling, what she's going through. Okay, raise your left arm all the way up and down. Raise your right hand all the way up. Okay, let's go in the back and see what's going on here. Swelling is down a bit, dude. Wow,
No, I know.
Good.
Yeah.
nice. Can you raise your left hand up, please? Slowly, all the way up and down. Raise your right hand all the way up and down. All the way up, slow. Something's blocking it here. And down. Out to the side, raise them up, both of them. A little bit of hiking on this side. Okay. So down, let me do passive test now, passive range of motion. Let's do two things first. Bring your left hand behind the back as far as you can up the spine. Nice. 1, 2, 3, 4. Bring it around, bring your right hand behind your back. This is testing the anterior component. When we have an AI shoulder, anterior, inferior, more anterior, person can bring it behind the back as high up the spine. 7, 1, 2, 3, 4, 5, 6. This one was 3, 4. This one is 6. Bring it forward. Next, we're going to do the chicken wing test. Passive range of motion. Let me do the work. Drop, drop. Drop. Passive, passive. Let it go. Let it go. And we're going to see which one goes higher. And you can see that it's not too bad. Right?
Right. I could feel it pulling now.
You can feel the pull. This one can go higher. This one gets a little tight. But the major restriction is the anterior component. Okay, it does this. Look. It goes anterior, inferior.
Okay.
The more anterior it's stuck, it's harder to bring it around. The more inferior, it's harder to laterally raise or abduct.
Gotcha.
Okay? And that's all secondary too. Let's make sure all the pressure's gone. Starting at the base of the neck. Do-do-do-do. Do-do-do-do. I just got a little bit of heat up there, but no pressure. There it is. T2, T3, right side. Let's see what we got. Mid back is clear, yo.
Love it.
I got like one. No. I ain't touching your spine, dude. I'm gonna do a little more of that pelvis for you, okay? It's 0. It's all clear. I just got that one right there.
And that meter doesn't work away from the spine?
It's for the nerves.
I gotcha.
It's for the nerves.
And no nerves here?
It's all coming from here, man.
I gotcha.
It's all coming from here. Number 1. Number 2, body is gonna readjust over the next month, okay?
Mm-hmm.
You gotta keep your movement, please. Feet together, scoot forward. Open and close the knees. Is that the Cuban in you?
Yeah.
Alright, left side only. Right side only. She tried to go gangsta.
So when I come in, it hurts me.
Okay, so don't come in then. Hold on, hold it there. If I hold here, open and close.
A little bit further out.
Same or better?
A little better.
Open and close.
Way better.
Right there?
Yeah.
So rotate the sacrum on the right. 3 or 4? 3 more tender. 4 feels a little bit more swollen. Raise your right hand up, all the way up. Down. Right hand up.
Way better.
Wow. Number 3.
Cool. Very cool.
Number 3, right pelvis. Let's go to the film real quick.
That's fantastic.
And let's see what we got. T1, T2, T3. T3 needs to be set a little bit different. T1, T2, this is T3. And TT is rotated as a PR, PRI, but it's a slight side slip. So it's a PRI, but here's the issue. It's a PRI with a side slip to the left, so we have to actually do it a little bit different on that right side. And if you guys really want to know how to do that work, it's not for me to teach guys out there how to exactly correct that. That's not what the intent of it is. But those of you who know what a PRIT side slip is, and if we do a PRIT as it is, it's going to be what? We're going to be adjusting into a concavity. So I'm actually doing a PRIT, but a spinous contact. Come over here. You ready for me?
Yeah.
All right. PRIT, spinous contact. 1, 2. And that's the home run.
I mean, wow.
Like butter, baby. That was a buttery home run. Slide up, please. Bueno. Chin up a tiny bit. Bueno. Good. Just receive. You okay there?
Perfect.
That's a piece. That's it. Un poquito más, we'll go on the side. Rock it out. Ow.
It hurt me. It hurts me.
Left side down.
Oh.
Left side down.
I don't make it look bad.
It's alright.
Oh my god.
It's all good.
Okay.
I'm alright. I'm alright.
Okay.
You're alright.
Alright.
Alright. Process versus event. Over there. Look straight, please. Bueno.
Perfect.
Good. That's a bit. Let's come back over here. Face down on the high low. A little bit more. One more time. Bring your right hand behind your back.
Wow. Wow.
Do some body work when you get back, nothing deep.
Okay.
Light Swedish if you want, okay?
Okay.
And
Yeah.
just a bit. Just a bit. Holding the right, pushing the left. That's it. A little more. That's it. Walk 2 times, please, and then we'll recheck. Doo-doo. What I did was I actually brought the sacrum up on that right side. I torqued it a little to bring it up on that right side.
It feels good. It's crazy when it goes down to your knee and now it's like in different areas of the knee. It's like what's happening here.
Have a seat over there.
Gotcha.
Bring your right hand behind your back, please. So 1, 2, 3, 4, 5.
Nice.
Left hand behind your back. Good. Bring it forward. Right hand behind your back. And let's do the anterior shoulder now. Let's go back one more on the high-low. We'll do it over here on your back.
Gotcha.
Slide over towards me this way. That's it. We're doing anterior shoulder, anterior here. Left hand on your belly button. Keep your head straight. Slide over a little more. There you go. And what I need you to do is let that shoulder go all the way down into the floor. There you go.
Hi. How It's those that I love. Like the immediates. Woo.
Because you have so much patience.
I mean, wow.
What?
I can fly.
Okay. Well, you are flying today.
Yeah, I know.
Ah.
You guys will miss me.
Ah.
Yeah, that was great.
Shasha's gonna miss you.
You too. You don't know yet.
I don't know. Have a seat. She got jokes. Right hand behind your back.
That's great.
1, 2, 3, 4.
Fantastic.
Left hand behind your back. 1, 2, 3, 4. Qué bueno. ¿Español?
Sí.
¿Sí? Are you hiding it?
Bueno, yo hablo español.
Oh, there's coming on now, show. Mejor,
Mucho.
mejor. ¿Está claro? Oh. Clear. Now you get to do scar tissue work, okay?
So when I go inward like this,
Yeah.
this is scar tissue that's and short ligaments.
Remember this had an indentation?
Oh, yeah, that's it.
No, the butt.
Yeah,
Where is it? Show me.
my indentation, it's almost gone.
Okay,
It's almost
so
gone.
let the tissues heal now, please.
Gotcha.
You want to get a buff and polisher? Get a buff and polish machine. You want to do gua sha? Do gua sha. You have Thai massage down there?
Yes.
You have someone do gua sha for your legs. Don't touch your back. Gua sha.
Wash is when you scrape.
Yeah.
The last time I did it, I went no.
Well, then you
They
have
didn't know
to,
what they were doing. No.
what's that?
Is it normal to go numb?
No.
No. Okay.
Too hard.
Oh, gotcha.
5, 4, 5, 4, Check it out. Got one last thing to do, okay? I know. Go on your back. When I go out, it's okay. When I go,
Just from right in there.
okay. So what we're gonna do is a little bit on that IT band. I don't like to do it, but again, this is all just decompressing.
Wow, I can't believe how much that hurts me.
IT band, guys, when the IT band is so tight, IT band isn't usually the cause, IT band is a result. And it's usually a result of G medius and the hip flexors and abductors, okay? So the idea now is you gotta get all this stuff kind of worked out there.
Yeah.
Okay? Not hard, consistent.
Ooh.
That's
It's
G
when you're not
medius.
even pushing on it.
I'm barely
It's
touching.
here. It's that. It's that. Okay.
Okay, so that's G medius and that's piriformis insertion. That means healing time.
Okay.
That's all. Stand up, please. Hold my hand there. Raise your right leg. This is your homework. You okay raising it?
Yeah.
A little bit different?
Yes.
Okay. I know, so. There you go.
There you go.
Released. Stay on
This hurts my buttocks area. What did I do to there? What did I do? What is
there.
this thing?
This all started, again, you're asking me the same question.
No,
from the
it's from
beginning.
don't tell me, my tailbone.
It's all coming from where? You have a rotated pelvis and a rotated sacrum and a drop sacrum on the right. When you come back, we'll redo your x-rays. We'll figure out where you're at.
Cool.
Okay?
Yep.
And the idea now is we have to figure this piece out. I didn't even get to your 5 on this trip.
L5?
Mm-hmm.
You want to do it?
Isn't it? I can't get there until all this is done.
Really?
Come sit. I'll show you. She's a difficult patient.
I'm sorry.
Have a seat.
I feel so bad. But I don't, but I do.
You don't.
I just,
Back. That's 5. I'm pushing hard.
I don't feel anything.
Right. Once this stabilizes, once this starts to adapt, this will start to show up a little bit.
Oh.
I don't think that the sacrum and pelvis is gonna fix that 5, it's gonna make it better though. So as I said, let me repeat. Lots of light massage, your movements, you have access to a gym, pedal backwards, lots of backwards pedaling. 10 minutes if you have a bicycle at home or a pedal machine. 10 minutes every morning. You run your feet all day.
All day.
Okay, so even more important.
Yeah.
Midday, you're icing.
Okay.
You're icing 3 times a day.
Okay.
Morning, afternoon, and evening. Okay? You check in with us in about a week. Let me know how you're doing.
Got it.
And 4 to 6 weeks.
Okay. That sounds
6
good.
weeks you come back.
Cool.
Okay?
Yes, sir.
You're all good. Stand up. Squeeze. Squeeze. Questions?
Okay.
We're good?
Yes.
Okay. Safe travels back.
Thank you so much.
You're welcome, my
Appreciate
good.
it.
You be good.
I appreciate it.
Any
Hush,
other
hush.
comments?
Shush, I love you.
Ah!